don't ignore that medical bill. And I'm not saying don't ignore it because the hospital wants their money. Don't ignore it because it stresses you out.
Hello, and welcome to the Hi-Fi Health News Podcast. I'm Erika Grotto, and I'm delighted to bring you this new show dedicated to helping you navigate the healthcare system. For nearly a decade now, I've worked at the Healthcare Financial Management Association, or HFMA, a membership organization of more than 100,000 professionals working in various corners of healthcare finance. But with Hi-Fi Health News, we're talking directly to you, the patients and consumers of healthcare. In this podcast, we'll be telling you what's happening in the industry and talking to healthcare insiders about what you can do to make more informed decisions about your care. And today's topic is one I think just about everyone can relate to: how to pay those big medical bills. I recently had the opportunity to talk with Shan Stack, who's a policy director here at HFMA. Here's what he had to say about this topic. So, Shan, before we get started, can you talk a little bit about your background and what you do here at HFMA?
Yeah, so what I do is I do a lot of policy work that is patient-facing, hospital-facing with revenue cycle, which is the accounts payable area of a hospital, business office, a lot of those functionalities that go hand in hand with patient care on the financial side. So really assisting patients to navigate and understand their medical bills, and also to get the medical bills paid by the insurance and coded and charged correctly. So that's a big part of my job, but overall, just analyzing and educating our members on healthcare policy is a big focus of mine here at HFMA.
So let's get into talking about medical bills. You see a lot in the media about how patients are paying more than ever for their healthcare. I see GoFundMes popping up every now and then for friends who are having trouble paying for a procedure or something. And I can't help thinking there must be a better way than asking your friends and family for $1 here, $1 there. So let's say you need some kind of medical care that you can plan for, like a procedure or a test. What should your provider be doing to ensure you know what you're in for financially?
If you're a self-pay patient, meaning you either don't have health insurance or you've chosen not to use your health insurance for a particular service that you're scheduling, or if you're seeking care out of network hospital or provider, the provider is required to give you a cost estimate, also known in the industry as a good faith estimate, upfront. Now, if you're self-pay and scheduling a service 3 or more days in advance, federal laws mandate that hospitals and providers must provide you with a detailed estimate. The estimate should include the total expected cost, any discounts you might be eligible for, and ultimately what your out-of-pocket expenses are likely to be. But it's important to remember it's just an estimate, and an estimate is, what the hospital can offer you. Many hospitals go well beyond that. I mean, I would argue that most hospitals go well beyond the federal requirements and offer estimates to anyone, including those right now who do have medical coverage. But to dig in a little bit to an area that often causes a lot of frustration for me and confusion and also for both hospitals and patients, some advocacy groups and news outlets sometimes oversimplify the conversation around good faith estimates, and it can lead to some serious misunderstandings. Here's an analogy, one that I'm not particularly fond of, but it's useful for illustrating the point. Think about when you take your car in for service. The mechanic gives you an estimate because until they actually pop the hood and diagnose the problem and get into the specifics of the engine or the issue, whether it's engine, transmission, or something else, they don't know exactly what parts or labor will be needed to fix the issue. The final bill for your car service might vary depending on what they find under the hood or wherever they're looking. That is somewhat similar to what happens when you're seeking healthcare for complex medical procedures. Take, for example, if you and I are both needing a knee replacement surgery. Even though we're similar in age, I might be a little older, and relatively healthy, the way our bodies respond to surgery could be very different. One of us might heal faster, while the other might face a longer recovery time, potentially extending our hospital stay, requiring more physical therapy, or needing different medications, such as different antibiotics to respond to. These variables can all affect the final cost, which is why hospitals can't give an exact price up front. They can only provide a well-informed estimate. And those estimates are really a median price that they calculate based on the service that you're coming in for. And while I don't love comparing the human body to a car, because let's face it, the human body is infinitely more complex, it does help to explain why exact pricing is so difficult. The good faith estimate just gives you a ballpark figure based on averages, but is not perfectly accurate.
And there are some instances, aren't there, where you can get not just an estimate, but an actual cost, like in diagnostics, right?
Yeah, and that's actually a great, I know this wasn't one of the things that we're thinking about talking about, Erika, but that is a great interlude into what is to come. I do think that most hospitals now are providing an exact cost on things like CT scans, MRIs, specific lab results that, regardless of what the outcome is, they're very singular in service, and hospitals can give you an exact cost on that.
Okay, so now you have an estimate or an actual cost in hand. You look at it and you say, there's no way I can afford that. I think for some people, that's the end of the conversation. I can't afford it. I'm not going to do it. But that's exactly what you shouldn't do, right?
That's exactly what you shouldn't do, because eventually, just like a car, if you ignore the problem, chances are the medical condition is going to get worse, right? So if you ever do find yourself, and many people do, and there's many scenarios where people are a little bit shocked by those charges on their hospital bill or provider bill, the first thing you really should do is call the customer service number listed on the bill. The team there can walk you through each of those charges and explain exactly what you're being billed for. If something doesn't seem right, they can look it up for you. And keep in mind, though, that it may take a few days for them to fully research that bill, look back at your medical records, see what was charged, and then make a decision on whether there was a mistake made. But my strong advice is to not delay reaching out. Call them as soon as you get that stressful situation so you can get that resolved, and they will be more than happy to work with you. Now, if it turns out that there was an error on the bill, which sometimes happens, you can rest assured that your hospital will make the necessary adjustments. Don't hesitate to ask that customer service person to set up a meeting with a financial counselor at their hospital. This is really important, and a lot of people think financial counselors are just there to collect money. But that's not at all the case. They are actually there to help you find financial assistance if you qualify. This could mean adjusting your bill through discounts that you're eligible for, offering charity care if you qualify, or helping you explore options like Medicare, Medicaid, marketplace exchange coverage, or even local funding depending on your situation. Please remember these words of advice. You do not want the financial counselor to adjust your bill to charity or financial assistance if you qualify for medical coverage and they can get you on ongoing medical coverage. The reason you don't want that is ongoing medical coverage will help you, the patient, secure a primary care doctor and get you covered for future care. That path is always hands down the best example and the best option, and to let them help you apply for those services because they are experts at getting you applied. And don't forget, if you have ongoing needs like help with transportation to medical appointments, food assistance, pharmacy support, or even help with housing and utilities, make sure you bring that up to the financial counselor, because most of these financial counselors in the hospitals are experts in the community where they reside and where they offer assistance to patients, and they can help you with those things too.
I love this advice because so many hospitals and provider organizations have these services and don't do a great job of letting patients know about them, which actually leads me to my last question. There are a lot of resources out there. Some of them have great advice. Some of them have not so great advice. What do you recommend when people want to understand how the system works and how to navigate it?
I'm going to sound like a broken record here, but don't don't ignore that medical bill. And I'm not saying don't ignore it because the hospital wants their money. Don't ignore it because it stresses you out. And anytime anyone has a medical bill out there, it does stress you out, or any type of bill, actually, not just a medical bill. So reach out immediately when you get that bill, or as soon as you can when you got that bill, to talk through your options and your solutions for paying that bill. My go-to recommendation always, especially if you have an established relationship with a primary care physician or a local community hospital, is to reach out to their financial counseling staff or administration for support. Those teams are your most powerful allies. They're deeply, deeply knowledgeable about federal, state, and most importantly, since you're talking about general resources, they are experts in your community resources. And communities do have specific resources that's only available in that community, and they can connect you to those. They understand your situation because they have your medical record right there. They know what your medical issues are, and they know how to best get you your support that's tailored directly for your issue. And they're best equipped to guide you through those options. Now, if you simply want to research financial assistance for medical care at a broader level, some great resources you can consider are healthcare.gov. If you think you might be eligible for Medicaid, Medicaid.gov. Your state health department or social services office will have a website that will have a list of patient resources there for financial assistance. And of course, your hospital and provider's website.
And for those of you watching and listening, we hope you'll subscribe to the podcast for more on how to navigate the healthcare system. Thanks for joining me today.